Good morning, everyone. This is Sujata Gautam from Nepal, and I would also like to acknowledge my colleague, Mr. Anil Gorkhali. On behalf of my team, I will be presenting on the 2030 Insight, what we have come through so far and the way forward. So talking briefly about the eye care in Nepal, Nepal has an extensive eye care network. In the map, you can see the availability or distribution of eye care services throughout the country. We have a center of excellence, tertiary and secondary level eye hospital, and almost every district has a permanent eye care centers. There is sufficient but inequitable distribution of eye care human resource. Nepal is doing more than 300,000 surgeries per year and more than 4 million eye consultation. Cataract surgical rate is around 4,500. Over the years, substantial progress has been made to improve access to eye care service in Nepal. So this pyramid shows the tier of eye care system in Nepal. So at the bottom level, there is the eye care community level eye care service, and then secondary level eye hospital, then tertiary level, and in the top we have the center of excellence, which includes the research and academic programs. You all are aware about this, so I won't go in detail since we are running out of time. So talking about the eye care situation in early 80s, the prevalence of blindness was considered as a significant public health issue. Eye care was in a very rudimentary stage since it was limited to very few government hospitals, and there was insufficient and uncoordinated human resources. And there was such a huge backlog of cataract that people who need the surgical intervention, cataract intervention, they need to travel all the way to India. So coming towards the 80s and 90s decade, then we adopted the public-private partnership in eye health. Many national and international organizations were invited to support and develop the eye care system in Nepal. Also, the geographical sector-wise public-private partnership model was adopted to ensure that the duplication doesn't happen while doing the service delivery. Development of human resources was created, which included mainly the mid-level eye care personnel, commonly known as ophthalmic assistant, and the MD ophthalmology and optometry program were introduced, which helped to create the extensive eye care network in the country. So with all these efforts in the last 4 decades, our major achievement is that we were able to reduce the prevalence of blindness by around 67%, from 0.84% in 1981 to 0.28% in 2021. Likewise, trachoma has been eliminated as a major health problem in Nepal. 2030 Insight in progress. Though there was significant reduction on prevalence of blindness by picking up the low-hanging fruits, but still we faced many challenges, mainly on the in terms of visual impairment and the emerging causes of blindness like diabetic retinopathy, glaucoma, uncorrected refractive error, and all these needs to get the attention. And also the eye care service and human resources were concentrated in the big cities and the flat areas, so the expansion to the remote and rural areas was very much necessity. So considering this, we needed a very effective strategy to implement, and hereby Nepal is committed in implementing the 2030 Insight Integrated People-Centered Eye Care, which includes the 3 strong pillars: elevate, integrate, and activate. So under elevate, we adopted multi-sectoral approach, and one of the good example of multi-sectoral approach is that we were able to eliminate the trachoma by empowering and engaging the people and communities. And we had the government advocacy efforts in SDGs, eye health included in UN VNR. Our Honorable Prime Minister participated in high-level meeting of eye health at UN. The meeting focused on raising the profile of eye health as fundamental development issue critical to achieving the SDGs. Further, as a result of the advocacy, Nepal recently included the eye health data under the UN VNR reporting system. National Eye Health Strategy focused on integration of eye care in pediatric diabetic retinopathy, diabetic program and geriatric health program. Under this, government also made some effort, and we had the coordination with government hospital and medical colleges for the early detection and treatment of eye conditions, such as the coordination for neonatal screening services. Likewise, collaboration with eye care providers and other health providers was established to ease on the conditions, other conditions like diabetic, hypertension, and all that, eye injuries. Under integrate, we adopted the following measures. Eye health has been included in national health policy that envision the integration of eye care into the government healthcare system. National Eye Health Strategy has been developed and endorsed by the Ministry of Health. Eye health has been included in the National Health Insurance System. eye care has been included as essential healthcare package. National RAP survey was completed in year 2021. National report on eye care situation analysis tool was published by Ministry of Health in 2024. Effective cataract surgical coverage has been included in National Strategic Health Plan 2023-2030 as a monitoring tool, and rapid assessment on refractive error survey is in progress. So under Activate, we have been celebrating World Sight Day at a national level to create awareness among the general people, political leaders, and the decision makers. People health-seeking behavior has increased through various promotional and awareness programs and integrated school eye health program. Under this, the school nurses are trained to assess the vision, and the vision card system has been introduced during the school admission. In this regard, Nepal government has implemented the School Education Sector Program, SESP, which emphasizes on the health priorities and mandating the vision checkups for school-aged children. So way forward. Despite substantial progress made over a few decades, we still need a lot to do. Nepal needs to further strengthen and continue these strategies to eliminate the blindness and visual impairment. Therefore, our focus remains on increased government prioritization towards the integration of eye health into general health, and the effective integration of eye health, including the integration of eye health data into the government data management system, IHMS. And all our effort and focus should be geared towards achieving the global target on eye health by 2030. That's all. Thank you.
Thanks, Sujata, for giving us an overview of a case study of how 2030 Insight strategy was implemented in Nepal.